Now, as we continue with our coronavirus coverage, we welcome back Dr. Jonathan Dario. He's a family physician and a hospitalist with Adventist Health. Good evening to you, Dr. Dario.
Good evening.
All right, question off the top about the president's comment today that he would like to see the economy open back up in 19 days by Easter, easing social distancing and putting some workers back to their jobs. Now, this says experts are predicting the worst is yet to come as far as infections are concerned. Doctor, I'm wondering if you were advising the president, what would you tell him about lifting this shelter-at-home directive by Easter?
Well, I would tell him that obviously we understand the concern of wanting to get back to our jobs and making that money. But at this time, this is kind of the tip of the iceberg for the cases. And if we lift the restrictions that we're doing too early, we put at risk of overwhelming the healthcare system and having just a flood of new cases for the coronavirus.
Now, Dr. Dario, we're hearing today that a new symptom has surfaced, the loss of taste and smell, and that some people who've tested positive for COVID-19 exhibited only those symptoms. So what have you heard about this? Well,
it's actually common for some upper respiratory infections to affect your smell, your taste, mostly because it affects your respiratory tract, and that would affect your breathing, so you wouldn't be able to smell really well. As for it being the only symptom for coronavirus, that would be on the rarer side of symptoms.
Okay, doctor. We've also heard how shortages of PPEs, the personal protective equipment, have tormented medical care facilities, putting doctors and nurses and other healthcare workers at unacceptable risk in the eyes of many. Are we turning the corner yet on the supply chain issues at the core of this problem, do you think?
I think, it's case by case basis, but at least here at Adventist, we know that we have enough supplies right now. We always address the issues. We're watching for the supply chain, and we're always looking for new resources to get supplies if it gets more overwhelming. Of course, that's always a concern for everyone. If the cases get worse and the amount of cases that we have, will we have enough supplies? But we're always addressing that, and we're always looking for planning ahead to make sure that we will have enough.
Now, hospital workers who have children at home are being caught in an increasingly tough situation, torn between those obligations at home with no child care available and their obligations caring for people coming into the hospital as well. One proposal is to have the governor sign an executive order allowing healthcare workers and first responders to transfer the paid family leave granted to them by the federal COVID-19 Response Act to someone else who can care for their children. Do you think that's a good idea or not?
I absolutely think it's a good idea. I mean, I've seen it from other healthcare workers who have to make that decision of taking care of their kids or going to work. I know that in cities like Sacramento, they've actually even done some support centers, family support, where they have centers for healthcare workers to bring their kids so they can go to work.
I got time for just one more quick question. There's also a call on the governor to create an emergency fund that healthcare workers and first responders can access to receive subsidized child care during this crisis. Any merit to that idea? Quickly, doctor.
I think it's absolutely a great idea. Anything to help out the healthcare workers and to alleviate some of that strain that they have on them is an absolutely great idea.
All right. Dr. Jonathan Dario, Adventist Health, thank you, sir, for your time. Stay well and stay safe, sir. Thank you.